subscribe now and press the bell icon. Never miss an update.
Welcome to Health Live at Seniors Today. We are delighted to be here once again with all of you. And the doctor with us today is Dr. Himanshu Verma. Dr. Himanshu Verma is going to be talking about deep vein thrombosis and vascular care for seniors. As it happens, this is the deep vein thrombosis or DVT month that is being observed from March 1st to the 30th or 31st. A little about Dr. Verma. Dr. Verma is a senior vascular and endovascular surgeon with the Fortis Memorial Research Institute, Gurugram. He is a doctor on the panel of Health Assist. He has experience at leading medical centers in India and the US, that is Mayo, in treating complex vascular diseases using both endovascular, that is minimally invasive, and open surgical techniques. His critical focus is on the treatment of aortic aneurysms, that is previously failed vascular procedures, peripheral gangrene, varicose veins, and diabetic foot. He is an expert in performing complex vascular surgeries under local anesthesia and thereby producing procedure-associated risks and stay in hospital. An award-winning doctor, Dr. Verma has also performed more than 3,000 complex avid fistula surgeries for dialysis patients. He has an avid interest in being up to date with recent developments in vascular surgery and has to his credit over 40 publications, including 9 book chapters and more than 25 presentations in prestigious national and international forums. We are delighted to have Dr. Himanshu Verma. Welcome to Health Live at Seniors Today.
Thank you, Pradhaman.
This is a question which I ask all our doctors, given the fact that COVID has been in the air. Yesterday, a friend of mine I heard was down with COVID. So is it really gone, or is it something that we should be still worried about?
I think it's not something now which you should be worried about, but definitely, yes, which we should be worried about. So I think it's been said on multiple platforms before that COVID is here to stay, but not in form and severity as it was, So anybody who is sick, that person, if he gets COVID, yes, things become very difficult for us. But so far in public and, touch wood, we also want that this is looks like it's going now.
And, I was reading something about an IIT Kanpur, and, since you mentioned earlier that you're from Kanpur, you may perhaps have interest in it, but there is some news about a recurrence around June. Is that something that you have been hearing, and are you all bracing yourself for that?
Nothing yet. I mean, see, we have seen the patterns across the world, the similar pattern which, follows in India. So far, we are not seeing any major severe pattern across the world. There's some news from some part of the world are there yet, but nothing serious so far. So, so far it should be looking happy.
Great, that's good news. And, the extent of the problem was huge in Gurugram, in Delhi NCR, as it was in Mumbai. And so clearly, people like yourselves also would have been through a lot of stress over the last 2 years.
Yeah, I mean, I must say this was one of those time where, the situation came down to, we were wondering at one time that what have we achieved by becoming doctors and doing, the great surgeries when a basic thing like patient is dying because of the lack of bed or lack of oxygen, But so that was really nightmare days.
One of the things that has been felt, and I must make a mention here, is in occasions like these is the ability to reach out to the right medical advice, and that is where we have felt that webinars like these have achieved a lot. And as you will find that a whole lot of senior citizens are either watching it live on Zoom, or they are doing it via Facebook or YouTube or our Twitter handle, or of course recorded. And just this whole thing about getting the right medical advice and getting good, qualified doctors from good qualified doctors is something that is the need for the hour. And that's where I think even organizations like Health Assist, etc., come to the fore.
Yeah. So, I always say that the biggest fear is the fear of the dark. So when somebody gets sick, or, or say somebody comes to me for the operation, some surgery has to be planned, then I personally love to explain them, step by step, step by step. And a lot of time patients say, no, we don't want to know this. My point is that if you don't know what is going to happen in that theater, then you assume the worst. We don't know whether I'll come back alive or not. So if you tell them step by step, they are mentally prepared for everything. One thing which COVID has really helped, that we are actually getting ready to understand what is happening. So, now I see people more and more interested in knowing, understanding the disease, which sometimes not some, almost all of the time helps to decide the outcome of a disease also.
Right, absolutely. So, doctor, let's move to the topic of the discussion, which is DVT or deep vein thrombosis, and of course, overall vascular care for senior citizens that is there. So, over to you, and then I would request people to put in your questions on the chat box or the Q&A tab, and please mention your age and gender as we request always, so that Dr. Verma could give a considered response. And if you don't want to give your name out, then you could just mention that, or you could just send in your question as an anonymous attendee. Over to you, Dr. Verma. Just a few opening remarks, and then we'll get to the questions.
Sure. So thank you. So I think we started with COVID, and I must say that we all must know a test called D-dimer. Okay. There was so many tests being performed as a household, and this was one of those tests which I think a lot of the part of Indians, we got to know what is D-dimer. But D-dimer has been there for very long, and today's topic, deep vein thrombosis, D-dimer has been the test related with that for every textbook we have always read. So I will start with in a reverse way. Deep vein thrombosis, if you want to understand, you have to understand what is thrombosis, what is vein, and then what is a deep vein. So I always give an example of if you compare blood to milk. So a freshly clotted blood is like curd. Okay, it's solid but soft. And you take the same curd in a bowl and leave it out in the open, say for a week or 2 weeks. Gradually water content will dry up, and that is what happens to a clot as it ages. Okay, so this is how a clot progresses. When the fresh clot forms, it's soft but solid, and when it becomes, say, like 2 weeks, 3 weeks, a month old, a year old, it keeps on becoming harder. Now come to vein. So we have two kind of blood vessel system in body. So heart pumps blood out from to everywhere via arteries, and veins are the one which collects blood from the whole body and bring it back. So and then comes this deep. So if you look at the structure of body's veins, especially coming to legs, there are veins that are superficial, skin, near to skin. Sometimes you can see green veins or some bulging veins. And then there are certain veins which are deep, which are near to bones. Okay. So any situation when there is a blood clot formation in these deep veins is called DVT. Okay. It's a very important thing to know for two reasons. One, it's a very important, the cause of sudden deaths. Okay. A second, because of so many reasons throughout the medical fraternity, the actual management, the immediate management and long-term management, still we see in clinical scenarios is, a lot of time it's missing or partially managed or sometimes over managed. So, first comes, I told a thing about the DVT, what it is, but what happens if DVT forms? And then will come causes and Then we'll also discuss about what's the specific kind of problem in elderly. But blood doesn't clot as long as it's flowing. Okay, so all those scenarios where the person is not moving much, so elderly who is sick, who is bed bound, blood is not flowing. How the blood flows from legs to towards the heart? It's our calf muscles. So when you walk, your ankle moves and your calf muscles actually pump the blood up against the gravity. Now, when you are in bed, not walking, then that's one of the biggest risk factor of being, the prone to the DVT, to the clot formation. Then again, there are certain, blood clotting disorders, but clotting disorders a lot of time are mainly, they can cause blood clot formation in very early age. So say, suppose somebody has got clot formation of DVT in 40 and 30s or 40s, they can develop, by the time they're 60s, they can develop something called a post-thrombotic syndrome, which is basically consequences of DVT. We'll discuss this about later. Then one very practical aspect we see is a dehydration. Okay. Now, if you drink less blood, if you drink less of the water, blood will become more thicker, and that will have more tendency to clot. Now, in men, I often see, because of prostate, the prostate is a very common problem in elderly men, and in females also a lot of time because of the UTI or varicose, the urethrocoel. The belief is that if you drink a lot of water, you'll have to go and pee for a lot of time. And a simple way is don't drink water. Okay, and that makes you dehydrated, and which keeps you at high risk of clot formation. And then many other comorbidities also, which become, as a part of aging process. So elderly in general, they are more prone to, deep vein thrombosis formation. Now, what happens with deep vein thrombosis? So basically, all the blood which was coming into your leg by arteries has to go back by veins. Now, if that path is blocked, okay, the extra blood will keep on getting collected in the legs, so it will cause swelling. So one of very common cause, one of the very common presentation of deep vein thrombosis is leg swelling. Okay, immediate risk. I think in the beginning I told you is one of the biggest silent killers. This curd, remember when I told that the fresh clot is like a curd? So this fresh clot can actually break. And, when the chunk of it gets broken and it flows into systemic circulation, that flows along with the blood and comes into abdomen, goes into heart, and gets lodged into one of the, arteries to the lung. So now, because the lung arteries are blocked, you're breathing, air is going, but blood is not coming into lung. So you feel suffocated, and this can, lead to sudden reduction in saturation. And this situation is called pulmonary embolism. Okay, this is one of the dreadest complications in most of the medical, specialties. It can happen in different format, but pulmonary embolism is often suspected when there has been a sudden death. Okay, and a lot of time when you take the history back, the history comes with the patient was immobile, or in Western setup, a lot of autopsies, they reveal the presence of a pulmonary embolism. So now, how is it especially important in elderly? Young patient will typically present as a leg swelling, pain on walking. When it moves to lungs, they will complain there's a chest pain, or they are not able to breathe. But because coming to swelling, swelling gets noticed a bit late in elderly because some other comorbidities there, and some swelling has already been there, so they tend to present a bit late. Sometimes they directly present with the embolism. because of other comorbidities existing, pre-existing. There's a general tendency to blame, okay, this may be because of that. Okay, today I walked, or maybe today I missed the medication. This may be because of that. Second thing is, we have seen, and I think we'll come to management and investigation a bit later. We have seen they tend to present to hospital late. So young person who is going to office developing severe pain, he usually comes on second or third day. But somebody who is onto bed, simply because they're not walking much, so they don't realize that there's a problem. By the time they realize, it's 2 or 3 weeks gone, and then they present to us. So DVT, expands. Now imagine a leg, and I will actually go back again on the cause and the formation of DVT. You have a calf muscles, then you have a thigh, and you have abdomen. Okay, the veins of the calf, they join, form a bigger vein in thigh, and then even a bigger vein inside the abdomen. When somebody has a DVT, this is also important to know which area the DVT is. Okay, DVT can be just in the below-knee area, that's the calf veins. DVT can be in the thigh, or DVT can be extending inside abdomen. Okay, so depending on how big vein it is involving, the symptoms can be very mild or maybe even asymptomatic to very massive leg swelling, and sometimes this itself can lead to the pulmonary embolism. There is one more important thing is, I said, and apart from the acute pulmonary embolism, there's something called as a post-thrombotic syndrome. So again, take the example of the curd. So when it is fresh, when it is soft, there's a risk of that clot formation, clot breaking and going into system. Luckily, this risk only remains there for 2 to 3 weeks maximum. So a clot which is formed, and this is yet in range of 2 weeks time, we call it acute DVT. Now, beyond 2 to 4 weeks, we call it a chronic DVT. Okay. Now, importance is this, that somebody who presents within 2 weeks time, there are options, the clot is still soft, and if indicated, we can remove those clots surgically. Now, luckily, we don't need surgery every time. We have modalities to either dissolve these clots, or we can suck them out through different techniques. But once, the 3-4 weeks have passed away, then the only treatment of this is to manage conservatively by blood thinners. And here is where the biggest catch I see, because vascular surgeons are less, and when we see patients of deep vein thrombosis and follow-up, we realize that a lot of physicians or a lot of cardiologists or cardiac surgeons, or maybe other doctors also, the initial focus is on giving blood thinners. So we see often they are giving over blood thinners, or but we have to understand there are 4 parts of treatment of deep vein thrombosis, which can decrease overall risk of DVT. One is blood thinner, which maybe if interested, we'll talk about. I think, Pradyuman sir, you are muted. We can't hear you.
Yeah, great. Are you done, or should I ask you some more questions?
I think it's better. Yeah, I think it's very.
So we've got quite a few questions in.
Perfect.
The first question that has come in is that is DVT hereditary? I've known that somebody in my family has got it. Is this a risk that is there? It's not my parents, but my uncle had it. Is there need for worry for me?
So every DVT is not hereditary. There is something called a hypercoagulable states. Typically, and there are around 5-7 conditions. And if a person who gets a DVT, especially, we find if the DVT was provoked or unprovoked. If it was an unprovoked DVT, that means patient was otherwise fine, but he just one fine day developed DVT. We test them for those tests. And if some of those come as a positive, then yes, that is a hereditary. And then we need to be worried about that. But I'll say in clinical world, most of the times the DVTs are not hereditary. And it's not only hypercoagulable state, it will be additional of other things. So if you had uncle had what kind of DVT, what age he had DVT, that is also very important.
Right. So the same person has said that I seem to have early signs of DVT, and I've heard of problems that people have in long haul flights, taking long haul flights. Now that travel has opened up, is it safe for me to travel, say, from Delhi to London?
Yeah. So I think early signs of DVT, I need a bit clearance, but clarification. But most probably, I understand you must be having some swelling in the leg and maybe some pain. We have to understand one of the very common cause of deep vein thrombosis is varicose vein, where you have prominent veins in your leg, or simply blood is not flowing from below to above. If you feel any kind of these symptoms, where you have some leg swelling, or you feel pain on long standing, when you're traveling long, you should wear stockings. Stockings help it a lot. They basically help to decongest it. These are available over the counter also, and you can also buy online. If you have serious concerns, and if you are having some symptoms like for only for a few days, you should consult your doctor before you make your travel plans.
Right. Thank you.
But I think this brought up a very important point, because it's a very common thing to understand. When you on a flight, especially on a long flight, there are things you can do to avoid clotting, which is true for everyone. You should walk intermittent. So every, say, 30 to 45 minutes, you should get up and walk. Your calf muscles help to move that blood. Okay. Second, anybody who has got a symptoms on long standing pain or swelling in the leg, they should carry a stockings. They help. And make sure you drink enough water, because that avoids dehydration. So these are a few simple things to avoid clot formation.
But in a typical local domestic flight, which say,
so this is for long flight. This is for long flight.
And local, flights which are typically an hour or two.
You can, so bare minimum thing you can do. You can keep on moving ankle exercises. So even while you're sitting, and just have a good water, have a drink water. So an hour of flight, I won't say you need to walk, but 2 hours, yes, yeah, take a break and walk.
Right. Doctor, we have another question that has come in, and this says that how do we know that we are getting DVT or varicose veins or whatever? Is there some kind of a checkup that one should do? Because the checkups that we do are your regular blood tests and ECGs, etc. Is there any way to get to know?
So if somebody has to rule out, so as I mentioned about D-dimer, I'm just clarifying it. D-dimer should not be used to diagnose DVT. It is used to rule out a clot. That means if D-dimer is normal, you can 100% say there is no clot formation. But if D-dimer is positive, you cannot be sure there's a clot. If somebody has a DVT versus has a varicose vein, there are separate tests for this. Okay. For varicose vein, first thing, DVT, is a clot formation. That's a blockage of the veins, whereas varicose vein is a leakage of the blood. Okay. Now, both can be easily detected by a venous Doppler test. It's an ultrasound of the leg and thigh. Certain details have to be filled in. So if you feel like any problem, I think we should better meet a specialist, and they can prescribe you for that. Okay, it's not something you can directly walk into.
Right. Doctor, there's a question which is that how do we, there are very few vascular specialists like yourself in smaller cities. They may be there in a Delhi or Mumbai, but we don't find vascular specialists in tier 2 cities. Is that a fact, or is that something?
Yeah, it's actually a fact, and I feel bad because before cardiac surgery, the first surgery was done in first vascular surgery was done out of body. In 1901, first vascular anastomosis was done by Alexis Carrel. When it was tried and tested in rest part of the bodies, then the cardiac surgery evolved. But in India, somehow still in the vascular departments have not been there much. Even unfortunately, even the AIMS doesn't have a dedicated vascular endovascular unit. So yeah, that's a fact. We are trying that, and we are trying to encourage more and more young surgical trainees to come and join vascular surgery.
Yeah, in fact, we've had this is our second session on with a vascular surgeon. We've had a session first with diabetic foot and on varicose veins with Dr. Paresh Pai.
Oh, okay, yeah.
From Mumbai. And
yeah, I know him. So it's a very small fraternity. Almost everybody knows everyone.
So to answer the question which he's or to ask a question which this person has not asked, is that if a person does want to show herself or himself to a doctor, what does one do? Does one go to a big city to show oneself, or can one take a teleconsult, or what should one do?
So see, DVT should be, if you want to show to locally, I'll just start with the very basic. You should go to, you can go to a certain group of doctors, either a general physician, a good experienced general physician, or a cardiologist, or maybe even a cardiac surgeon, because they deal with these very often in their practice. Okay. If you go to a urologist, or and do not, I mean, no disrespect, I mean, everybody knows it, knows how to manage things, but a lot of time, if what I have seen, people go to orthopedician, some pain in leg and calf muscle gets misjudged as a, say, some muscle trauma. They get some painkillers and then they come back in 1 week's time. So don't do that. Okay. If you're suspecting anything near to DVT or some clot formation, consult at least a cardiologist. Anybody who is suspecting, they will immediately get a Doppler done, and based on the Doppler report, then you can easily, the Doppler report is good enough thing to consult, to even take a teleconsultation from anywhere, from any city in the India, because some clinical questions and some basic parameters, blood reports, and your Doppler report is good enough to give you a prescription.
Right. Thank you. Doctor, we have a question from Ajit Menon. Mr. Ajit Menon, who's a regular at our various health webinars. He says, Doctor, I'm having hypertension for past 2 decades. I'm diagnosed with DVT, LH leg for the last 5 years. I'm having rivaroxaban 15 mg once for DVT, and amlodipine 2.5 mg per day for hypertension is being taken. Edema is observed in left leg, calf in the morning. Any change in hypertension medicine or lifestyle modification can eliminate the edema of leg, he asks.
So a couple of things. The management of deep vein thrombosis is not only blood thinner. Okay. Your calf muscles have to become good. They have to become strong so that they can pump that blood out. Okay. So walking is good. Now, walking without stockings is not good. Stockings are the medical grade stockings which we use, called the class 2 compression stockings. These are tight socks that come, which are the tightmost at the bottom, at the ankle, and as they go up, they become the pressure becomes less. So they kind of set up a gradient for blood to move from feet to up. So you have to use your stockings daily. Okay. Most importantly, when you're going for a walk, you have to use them. Okay. Then you have to make sure that you're drinking enough water. and then additionally you have your blood thinners. So it's not only your blood thinner is going to cause your leg swelling to go. I'll come on this why we give blood thinner, but you also are taking amlodipine. You should consult your doctor who has advised this to consider changing amlodipine, because 10 to 15% of patients who are on amlodipine otherwise can also cause some leg swelling. So that may be also a possibility. But I think if you add stockings and regular walking to your practice, that will help you.
Doctor, there's a question that has come in when you were just making this remark that I am overweight and wearing stockings is very difficult. What should I do?
So, okay, so if you are overweight, first thing I will say, stockings come in two lengths. One is the thigh length, one is the below knee length. So never ever think about going for a thigh length, because if you put on the thigh length stockings, even with the best effort, if you put them on, the moment you walk, they roll down and then they form kind of a constriction. So do not use. Okay. You can use a below knee stockings, and there are certain helps that come. So there is a company called Sigvaris, and if you Google Doff and Donner, DOFF and Donner, DONNER, it's a very good, nice silicone kind of silicone case, which is very helpful for especially obese patients to, you can just, you hardly take 20 to 30 seconds to slide entire stockings up. So that's something. But right. Yes, I agree. There are certain patients where putting stockings is difficult. There's some other things like rib bandage and some other things can be done.
Right. Thank you, doctor. There are a few questions that have come in. One person who's an anonymous attendee says she's female, 76, several spider veins, discoloring feet, and is visible, but trouble-free varicose veins in the calves. Can anything be done? And I think it's the same person who says, I also cannot stand for more than a brief while, feel the need to sit down.
Okay. So first thing, what is it which is causing you to sit down? Is it weakness or disbalance, or it's a pain and swelling? Because if it's only varicose vein, typically what happens is just varicose vein. If you get up immediately, it won't affect. Only it's a matter when you walk certain, say 300, 400 meters, or even few 10, 15 minutes, half an hour, then only blood will start gradually pooling into your feet, and then you will feel the problem. Okay. So if it is something which you immediately get up and you're not feeling well, that probably it's something else. It's also important to understand that because of the post-hormonal changes, if you look at women between 40 to 70 or 80, more than 50% women will have some or other form of varicose veins. A lot of them may be just, asymptomatic and cosmetic. So, and same time, it's a fact that your leg and feet, they don't only have veins. They may have joints, they may have nerves, the muscles. So clinical correlation is very important.
Right.
When 20 patients walk to me of this age group with varicose veins, usually two or three are candidate for varicose vein surgery. Most of time we find that, okay, culprit may be something else, and we have to find an appropriate specialist for that.
Right. Thank you. Doctor, we have a question from Katie Davanchi, who says, my husband is 77, has varicose veins, which are more visible and swollen behind his knees. But there is a slight pain sometimes and some swelling as well. Would compression stockings help him? When he sleeps at night, he sometimes gets cramps in the calf muscles. Is this due to varicose veins, and what treatment would you recommend? He is slim and otherwise active through the day. He takes amlodipine 5 mg for his blood pressure.
So yeah, symptoms may be because of varicose vein now, and definitely stockings will help. Here, one thing I would like to add, just like the DVT, I should have actually mentioned it earlier. There's something called the SVT, superficial vein thrombosis. And in COVID times, we have seen it much more. And what is SVT? In leg, you have two kind of veins. One was the near bone, which are the big size, huge veins. And then you have veins which are just below the skin, which are actually sometimes feeders for these, the spider veins and all. So if the clot gets formed in the superficial veins, typically that area will become, initially become red, a bit hard. And when you press, it will be tender. Okay. So it's, typically people say that, okay, we had this varicose veins like for years, they were okay. Now suddenly for a few days, they started paining. If this is happening, it's important to, notice, not to miss, and go and meet a doctor, because now those innocent veins have formed clot, which if you do not treat in time can progress to deep vein thrombosis. Okay, so I think right now let him have a stockings, pair of stockings. If there's a very significant pain at certain point, then you should get a Doppler and seek a consultation.
Right, thank you. Doctor, we have a question from Usha Jacob, who says, Doctor, you said about pain in the leg due to long standing as an indicator for DVT. Sometimes I do have to stand for 2-3 hours. Does it mean I have symptoms? I do not have any swelling or pain in the calf muscles.
Okay, I think with this question, I will again remember one part of the last question, the night cramps. So DVT, my purpose was not to scare anyone. DVT is two kinds, acute DVT and chronic DVT. Okay, believe me, if you had an acute DVT, you will feel like some symptoms which have just started within few days. Okay, but if it has been there for very long, say maybe for months or years, probably they are part of a bigger scenario, which is called as a chronic venous insufficiency. That means in general, veins are not able to pump blood from leg to above, so that when you stand long, a lot of extra blood gets collected in your feet and you feel discomfort. Okay, now it may be either varicose vein, it may be somebody who had a DVT long back, now some pieces are remaining, or it may be person also who had a maybe few weeks back DVT. No, it's a very individualized thing, and I think based on person to person, we clinicians will decide. But what you can do at home to check, and as a preventive or as a therapeutic thing, you check whether once you have symptoms, whether leg elevation helps it or not. So if you're having some pain or something, you put 2 or 3 pillows up and you feel whether your leg swelling and pain is going. You correct your dehydration level. You improve your water intake, and if you see whether this is helping you or not. These are 2 things. If they are yes, then probably yes, there's something venous component, maybe varicose vein, chronic venous insufficiency, or DVT.
Doctor, there's a question which is that, is taking a massage harmful for somebody who has DVT?
Okay, so yes, somebody who had an acute DVT should not take leg massage. You won't know it's an acute DVT or not. So somebody who had an acute onset swelling of the leg, they should not get a massage, because it's a soft clot, which by massage you can actually dislodge, and it can lead to a deadly complication.
Right. Doctor, we have a question from Mr. Suresh Khate, who says, in case of valve calcification problem, what has to be done? There's no leg swelling. He's 69, suffering from valve calcification for the last 1 year now. After diet control, reduced weight 24 kilos from 100 to 76, reversed diabetes as well. Can calcification be reversed with a lot of precautions and normal exercise, or is surgery a must?
So I think yes, a bit of things are getting mixed. So because valve is the term is for veins, also for the heart. So and venous valve calcification is not something we usually see. So probably he's talking about his valve calcification of the heart, which is a problem, but not related to DVT. In general, these calcifications are non-reversible. Although with your regular, the good lifestyle modification, sometimes you can still avoid your surgery if your symptoms are not much. I think a cardiac surgeon will be best person for that. We deal with the venous valves. So, so that's the thing.
Great. Thank you, Doctor. You have been able to answer quite a few questions. I'm sure there are quite a few questions that has come that people have and they haven't asked. But Doctor, tell me this is the question which a couple of people have asked as to what are the general preventive measures, and Mr. Brish Dugal has just asked, what preventive measures can senior citizens take to avoid DVT? Are there some exercises? Is there some yoga? And there's another question which is asked, and I know it's a wrong question to ask somebody who is from the allopathic thing, but are there treatments available in homeopathy or allopathy or Ayurveda, or even things like acupressure and acupuncture? Are there therapies in that?
So, okay, I think I would love to answer this because I'm from BHU. I've studied with people who have been into Ayurveda, and it's not a rivalry. It's like, yes, we respect each other's branch and we know. So if we are going to preventive, yes. Okay, and preventive measures, yes, there are so many things as a lifestyle changes, not in only allopathy, in Ayurveda as well as yoga. Okay, so the good hydration, making sure you're not sedentary. So why even elderly are at high risk of forming DVT? Because of less moving. So making sure you're walking well, and so these, and if you by chance if you're limited, then making sure you're using stockings or doing appropriate leg elevation. Okay, these are the basic things we can do. Also, somebody has to be observant, especially if you're also suffering from some other diseases, about the leg swelling, and especially if it is only on one leg and not in other leg. Okay, a lot of time DVT only starts in one leg. So if you think, oh, today's swelling is there because I was sitting, then why it is only on one leg? Why it is not on other leg? Okay, although bilateral DVTs are also possible. Okay, so these are few basic things. One thing I will actually would like to put it, I do deal a lot of time with the kidney patients, okay, who have been kidney failure patients, and a lot of time they have to get the lines. So there is a iatrogenic DVT also. So because of something, if somebody got admitted in hospital, and that time doctors had to put in some injections in either near the groin, so that needle trauma itself can induce a clot formation, which sometimes gets missed.
Right.
Okay, so
just we have one last question which we have from Mr. Rajpal Singh. He's 83, okay. And he says, I have edema swelling on my ankles and legs. I'm taking Daflon 500. I cannot put stockings as I have a skin problem. Kindly reply. And the other question is, does Daflon have side effects? I'm taking Daflon 500 twice a day. That's Mr. Rajpal Singh, who's 83.
So, sir, Daflon doesn't have major side effects, but the quality of response it gives you also not very great. So a good kind of compression on leg elevation will probably give you more results than simple dose of Daflon can give. Okay, that's we know. So if you have a problem with the skin allergy, and if you really are suffering, the good thing is that treatment for varicose veins are really minimally invasive these days, and these are actually office-based procedure. Before we go, I think I would like to mention one part of the chronic DVT also. So if you really have symptoms and which are bothering you, you should get a venous Doppler done. There are things available where you can actually, your requirement of stockings can be stopped by fixing those veins. Okay, so Pradipin, so actually I was going to tell, this was what happens to someone who had a DVT, say like 10 years back. Okay, And as part of my talk, two things I missed. One is, if you're taking medications for, you had DVT, you went to a doctor, you started medications, everything is going on good, it's been a year, now what should we do? So should we discontinue or what? So based on the individual patient discussion, the medications are stopped or decreased, and same time other things are increased, like uses of stockings has to be increased. So that recurrence is a big problem. Somebody who has a DVT is a few times higher risk of having it again once you stop medication. That's number one. Second thing is the chronic venous insufficiency leading to venous ulcer. That is a huge thing. And a lot of time I see patients who might have had a missed DVT, maybe during their women, a lot of women, they have a DVT when post-pregnancy. That time it just gets, missed as some swelling. And they present to us 20, 30 years later with non-healing ulcers in the leg. Okay. So venous ulcer is one of the very, devastating long-term complications of chronic DVT, which happens at the post 50s and 60s. It can happen in early age also. So just knowing that can be treated is very important, because just by doing dressing is not sufficient.
Right. Thank you very much, doctor, for your time today. We've answered several questions, and always a delight to speak with doctors who are as committed as yourselves, and of course all of them are. And we will of course come back to you again, because there seem to be quite a few questions that are there. For those of you who are here, before I let Dr. go and end the session, we do these health webinar sessions every week. And on the basis of several requests, if you would like us to pre-register you and send you your registration links as soon as we have a confirmation from the doctor, please fill in the form that we have, which we've just put up on the chat window. And once you fill that up, we will pre-register you, and you don't have to register every time, or you don't have to look for the links and stuff like that. I know people like Mr. Gudeep Shaw and all sometimes call us up and say, where is the notice, all of that. And, so this is for y'all, this is for all of you who are regulars at our sessions and have been taking advantage of all the advice that is there. There's also a lot happening at Seniors Today. Dr. Seniors Today is a magazine that we have been publishing since July 2019, and it is published on the 15th of every month. And the next issue, as we speak right now, we have our colleagues working on it, and it will be out on the 15th. I can, for the benefit of everybody over here, it's a magazine. This issue, every issue is unputdownable and a must read, but this issue is of special interest for people who are regular attendees, and because it is on superfoods. So, and we have a doctor who's written it, and it's on 55 superfoods that one must, include in one's diet. And of course, all our regular features that are there. You can subscribe to our website newsletters, which come at 6:30 a.m. every day, Monday through Saturday. And, you'll get an idea of that. There are quite a few events that we do through the year, through the week. In fact, something on yoga as well. So if you would like to take advantage of that, you can just drop us a line, and we'll also put up a small WhatsApp group that we have set up, and you will get notifications every day about the events that are there. And we have sessions like Kabir Wani, we have poetry, we have somebody talking about the A to Z of karaoke singing. And of course, we are, Seniors Have Talent is continuing as always. Tomorrow is Group C of Seniors Have Talent, and there are a dozen odd 60 plus senior citizens who are participating. And the theme tomorrow is Kalyanji Anandji songs. So you can connect tomorrow at 11 a.m. for that. So a host of things happening, Doctor, in our commitment towards engaging, enriching, and informing senior citizens. And thank you very much for joining us.
Thank you, and thank you all of you who have been there. I think I hope I was of some help to somebody answering some questions, and I loved being part of such a wonderful interacting audience.
Thank you very much, and we'll approach you once again, because sometimes we would also like to do sessions in Hindi, and we would request you to speak to our attendees in Hindi as well. Thank you very much once again.
Thank you, sir.
Subscribe now and press the bell icon. Never miss an update.